first virtual panel. My name is Santoria Harmon, and I am one of the founders and executive directors of L.E.N.D.ing. I'm a wife and mother, healthcare professional, and also the owner of Santoria's Events, LLC. I'm a native of San Diego, California, and I currently reside in Dallas, Texas. Just to go a little bit into L.E.N.D., just a little bit, it stands for Let's End Neonatal Deaths. And our purpose is an organization to create social stability and awareness on neonatal child loss. The targeted populations benefited will be the women in the pre-pregnancy, pregnancy, and postpartum stages. We are really big on, we want to create a venue of advocacy for appropriate reproductive treatment, prenatal treatment, and also neonatal treatment. We're an advocate for the society whereby all babies and mothers will have equal rights and opportunities of survival. We want to increase awareness around neonatal child loss and prevention through community, international projects, lectures, and also the legislation. And I will pass it to Sonia to introduce herself as well.
My name is Sonia Gibson-Dixon. I am also one of the founders and the executive directors of L.E.N.D. I am a teacher, I'm an author, I'm an owner of Spoken Hearts LLC, which is a self-publishing book company. I am originally from Chicago, Illinois, and I currently reside in Baltimore, Maryland. So today we decided to do a Preeclampsia Awareness Forum because we feel that foremost, let me acknowledge today and the significance of the day. Today is May 22nd, and it is National Preeclampsia Awareness Day. The whole entire month was dedicated to preeclampsia, but on today we decided to actually host this forum because we want to create a platform and a space where women, and not only women, men, and families have access to resources and also testimonies and stories that may benefit them as they move forward. We also are pushing to fundraise. We have some legislative initiatives as well as some other things planned regarding preeclampsia that we feel should be put in place on the federal and the state and local levels, which is why we want to bring awareness to this issue. We also want to bring awareness because high blood pressure, hypertension is something that affects people in general. And if you are already battling this medical condition and you get pregnant, or even though you may not already be battling the actual medical condition prior to pregnancy, there are some important things that you need to know. I know for me, I come from a history of a family that has hypertension already. So for me, I've never been diagnosed with preeclampsia, but I feel it's very important, not only for me, but for others to have access to the resources and information. So I thank everyone for joining us and just being here to share your stories as well as your skill set and your experience with preeclampsia as well as eclampsia. So we are going to start off by allowing our guests to actually just tell us a little bit about their preeclampsia experiences. From there, we will then follow up asking a few questions that the audience may have, or if they don't have questions that may be important. And then at the end, there will be a question and answer session for anyone that has questions. So we're going to start off. I want to tell you all, I thank you all for really attending. We performed a lot of research on you all, and your stories are changing lives, and we're excited to have you here to continue to change lives. And it says a big thing. It's a huge testament to the fact that I was just researching and just doing a lot of things maternal and neonatal based, and came across you. And I'm sure I'm not the only person that's come across you in your story. So understand that there are people watching you, because I'm not even in the States. Well, Miss Tibbs, we're in the same location, but everybody else, we're virtually located other places. But please know, whether you're getting 1 like, 2 likes, 3 shares, 4 shares, there's somebody watching, because I definitely was watching. So we really appreciate you for just being brave and sharing your story on your platform so that you can come and share it here. So we are going to start off with Miss Jayla Johnson. So could you please just give us a brief introduction about who you are and then your experience with preeclampsia?
Hi everyone, my name is Jayla Johnson. I am 23 years old and I'm based here in Houston, Texas. I was diagnosed with preeclampsia earlier this year, first pregnancy, and I have had no history with high blood pressure. So it came about suddenly. One Monday in February, I had went to my doctor's appointment. Everything had been good. And by that Thursday, I attended a health fair, decided to check my blood pressure on a whim. Didn't expect anything because I was like, oh, I've been to all of my prenatal appointments. You know, my blood pressure has always been good. There's no issues. That Thursday night, my blood pressure was 160 over 120, which kind of alarmed me at that point. You know, I hadn't really heard a lot about preeclampsia, so I called my doctor the next day. She got me in. It was still, you know, that level. She ended up sending me to L.E.N.D.ing, just to get checked out, observation. You know, they gave me medicine, sent me home. That next week, I went in for a follow-up. Same thing. Blood pressure was, you know, 160s over 120s. My OB went ahead and made the decision to transfer me to Texas Children's Hospital in the medical center, which has one of the best high-risk OBs, has the best NICU. You know, that's kind of the center here in Houston. From there, you know, I learned a lot more about preeclampsia because, like I said previously, I hadn't really heard much about it. I mean, it's been mentioned, you know, my prenatal appointments, but it was never really explained at that point. I was there for 33 days. When I got in, they went ahead and let me know, you know, you have severe preeclampsia with severe features. So I had a headache. Besides my headache, I had no symptoms. So I wouldn't have known at all if it hadn't been for, you know, just checking my blood pressure on that whim at the fair. So got in, they went ahead and let me know that they were planning to keep me until delivery. At that point, I was 29 weeks. So they were shooting for 34 weeks, which they felt was that balance between, you know, keeping my health okay and having my baby get enough that he needs. So during that time, lots of blood tests. I was getting blood work done every morning to measure my liver enzymes and my platelets. Those were the two, you know, biggest things that they were looking for in my preeclampsia. Because if my liver enzymes kind of went out of whack or my platelets went out of whack, that's where, you know, they were making that decision of this is, you know, not good for you. You know, we need to go ahead and deliver. Mm-hmm. So I delivered at 32 weeks and 5 days. The night before my delivery, my blood pressure kind of went all over the place, even on the medications I had been on for 3 weeks. So those same medications were no longer working. So they, the next morning, you know, they wanted to go ahead and do blood work. And they let me know if the blood work comes back, anything's off, we're going to go ahead and deliver you. So that next day they did blood work. Everything actually turned out good. But in my fetal monitoring, he wasn't moving as much. And my amniotic fluid had dropped a lot. Oxygen levels had dropped as well. So with that, they went ahead and sent me over for an emergency C-section that day. So within a 30-minute span of me getting my ultrasound, I had delivered. Mm-hmm. With that, even after, you know, I still had to be on my blood pressure medications, trying to still lower it and keep it lower because a lot of women do get, you know, postpartum preeclampsia. Mm-hmm. So they wanted to just, you know, be sure that, you know, that wasn't coming back. So I was in the hospital 4 days after I delivered just to make sure that that didn't come back. So I'm now 9 weeks postpartum. So I stopped the blood pressure medication. I was able to get off of it at 6 weeks. Okay. Yeah. So it was a journey that was very unexpected. Like I said, I didn't have any history of high blood pressure. You know, just earlier that week, I was fine. My blood pressure was, you know, good. But all of a sudden, it just completely shifted. So I'm very thankful, you know, for having an OB who was like very on top of things. She was very much just, you know, everything that I told her, you know, she was like, okay. You know what? I need to make this decision. It's in your best interest for me to go ahead and transfer you to a bigger hospital. So very thankful for that, you know, just being aware of symptoms or even, you know, for me, like I said, I was asymptomatic. Mm-hmm. I had a blurry vision, the, you know, headache, no medicine was helping, the upper, you know, right quadrant pain. I didn't have anything. had swelling, but, you know, a lot of people kept saying, oh, you know, you're pregnant.
Mm-hmm.
You're gonna swell, you know. But, you know, in that last week, the swelling became worse.
Mm-hmm.
So, yeah, so that was my journey with preeclampsia. Like I said, I'm now 9 weeks postpartum. I have a beautiful baby boy.
Oh.
Born 3
Oh.
pounds, 0 ounces. Because due to the preeclampsia, he had IUGR,
Mm-hmm.
so intrauterine growth restriction, because my placenta wasn't providing him with enough nutrients. But he's doing good. He's now almost 8 pounds. So,
Well,
yeah.
congratulations, new mom.
Thank you.
And we thank you so much for sharing your story. We do have a few questions for you, but we're going to hold the questions until everyone just share their experience.
Sounds good.
Next, we're going to have Ms. Tibbs.
So thanks again for having me.
No problem.
My preeclampsia journey was a little different in that I had chronic hypertension, and it actually ran in my family. My mother, as a matter of fact, she experienced preeclampsia with her last pregnancy, my youngest sibling. And then to complicate it, I was pregnant with twins. I was advanced maternal age. So my OB was closely monitoring my blood pressure because of all those risk factors. And so I was taking blood pressure medication, monitoring my blood pressure, getting a lot of lab work done as well. And then maybe around 26 weeks is when things started to change. I started experiencing headaches. I actually had gone to a neurologist. They had put me on medication for that. And even to go back, around 24 weeks, they actually admitted me into the hospital for hospital bed rest because of complications of preterm labor. I was pregnant with twins, so I had experienced preterm labor as well. So around 26 weeks, labs started to change. They were monitoring my protein more frequently. Had to, on top of just the medications that I was on during pregnancy and even before pregnancy, I had to experience magnesium sulfate at least 3 times during my hospital stay. So that's, if anyone's ever experienced magnesium, it's a horrible drug to be on, very uncomfortable. So that helped. But then around 30 weeks, the doctor came in, actually the night before, they had wanted to monitor my proteins in my urine, a 24-hour urine. And that morning, they couldn't even finish get the results from the urine test because my lab work that they had done maybe overnight came back positive for my liver enzymes being elevated. So they decided at that point to do an emergency C-section. So at that time I was about 30 and 6/7 weeks. So they went ahead and did an emergency C-section. But even before the section, I never experienced any symptoms like headache, except for the headaches. I didn't really have any abdominal pains, blurred vision, nothing, no swelling. I never experienced any of those things, just a headache, but once they put me on the medication, it sort of helped. So they did the C-section, boys came out crying, went to NICU. They did well, they didn't suffer any damage from the preeclampsia or from hypertension, thank God. And then maybe, had complications, other complications during my postpartum journey. So my postpartum journey was really rough, on top of just dealing with the hypertension, and experienced postpartum preeclampsia as well. So the journey afterwards was with the blood pressure was probably more of an issue after I delivered. That's when I experienced the swelling. I mean, my feet would actually jiggle when I walk. I mean, I've never experienced anything like that. Like the swelling was just like my skin was like transparent. Experienced that for about a week or so. And then maybe in all my blood pressure, even with blood pressure medication, it took about 2 months for it to finally, be manageable. About 2 months. I mean, I would have blood pressure readings anywhere from like 190 over like 120s. It was just crazy. And oftentimes I would go back to the ER, thinking that reading is abnormal. Even if I'm at home monitoring my blood pressure, I would go in, as the doctor told me, whenever your blood pressure reading is XYZ, go back to the labor and delivery or the emergency room. I would go and they would just kind of be annoyed that I was there because now I'm not pregnant anymore, so why am I there? So it would be kind of like that type of attitude, unfortunately. But like I said, after about 2 months, it was finally managed. And as of today, 8 years later, I'm not on any blood pressure medication.
That's good.
And that's a blessing. Came across your story on the Birthish podcast, and
Yes, sure.
it was really powerful because you said, like, even prior to getting pregnant, there was just so many things and so many hurdles that you overcame, and you have a really true testimony on so many levels. So I really appreciated listening to that, and you actually sharing that, because we had a lot in common as I listened. So I'm really grateful for that. And also, since you're in the area, that also is a plus as well. I know that you're a doula, and you have some amazing things going on. So I'm excited to be connected and close to you.
Me as well.
Thank you for sharing. And now we are going to have Bruce McIntyre,
Perfect.
Ava Rose Foundation. We welcome founder Bruce McIntyre. Bruce is the fiance to Amber Rose Isaac, who recently passed away in a New York hospital due to the HELLP syndrome, which is a serious complication of high blood pressure during pregnancy. So L.E.N.D. thought it was extremely important to have Mr. Bruce McIntyre on the platform to bring awareness to the HELLP syndrome, along with the medical treatment of women during the COVID-19 pandemic. And we know for the women that are pregnant, this is a really scary time. It's already scary being pregnant, but that is heightened now due to the pandemic. Mr. Bruce McIntyre and the Save the Rose Foundation also aims to bring awareness to medical neglect and treatment of pregnant women of color. Due to medical incompetency, Black mothers die at rates 3 to 4 times of their white counterparts. And these statistics are heartbreaking and they're very alarming. It's time to ring the bell. So with organizations like Save a Rose and L.E.N.D., along with the brave individuals today that have decided to share their amazing testimonies, a change will come, because it has to. We will now give Mr. McIntyre some time to talk more about his organization, his experience, and its significance.
So actually here in New York City, those rates are actually they run from 8 to 12. You know, Amber was exceptionally healthy. You know, she took very good care of herself. We were on track to having a low risk birth at Montefiore in the Bronx. You know, after feeling like we weren't being heard, we explored out of hospital options and tried to find the best for our son. You know, the level of neglect at Montefiore was such that Amber's labs indicated concerning platelet levels, and Montefiore never told us about it. You know, it was up until the midwife that we consulted with pointed this out on Amber's records. And that's when we became aware that she had any health concerns at all, actually, throughout the pregnancy. You know, even after we followed up with concerns within the hospital, they made decisions and you know, that were incongruent with Amber's medical needs. They recommended induction and C-section, as they do with many women of color, you know. They're not taking the proper precautions, and ultimately, you know, this lacks of proper medical attention, you know, and that's what led to her death, you know. So it's important that we educate ourselves on the facts. If women are low risk, I recommend that they seek care from a midwife. If they're high risk and they have to rely on a hospital's care, you know, I would at least recommend hiring a doula and to work and educate myself and the community and educate them on birth options and advocacy, and hope to partner with Birth from the Earth. They're a group based out of Yonkers.
Okay.
So Birth from the Earth and Save a Rose right now are trying to bring a birthing center to the Bronx to continue Amber's legacy and goals. Just spread that for us. You know, we really need a birthing center out here in the Bronx. There's one hospital out here in the Bronx specifically that has low C-section rates, and that's only due to 70% of their births are overseen by midwives and doulas. You know, so everywhere else just has really high C-section rates. So that right there is why we need a birthing center out here in the Bronx. There's only one in Brooklyn, and not everyone has the luxury of commuting all the way to Brooklyn. You know, women are always having to go out of their way, get the proper care that they need. I've seen women drive 4 hours away from where they live just to give birth, and that's absolutely ridiculous. You know, 60% of the care you receive out here, you won't receive from somewhere else. So yeah, it's very important that we're educating ourselves. So Amber she developed HELLP syndrome. You know, 30% of women around the world develop HELLP syndrome, 1.1% mortality rate, 100% preventable.
Absolutely. And we send our condolences, and we definitely thank you for joining us. And we definitely want to be a part of your mission. We know that you are now a father as well. So you're balancing a lot of different things. And we appreciate you for being strong and bringing awareness to this situation and being an advocate for Amber, and also just an advocate for women around the world, because I haven't had preeclampsia, but I've definitely dealt with medical neglect. And as a result, terrible things have happened. So I definitely appreciate you being here as well. And when we allow Dr. Alisha to share her story, and then from there, we won't ask where we have some questions, but I want to hear more about the Save a Rose Foundation. I want to hear more about where we know what your mission is, any initiatives, because we're here and we definitely would support you. And anything that you have going, we want to assist you with pushing the mission forward. And that's for all of our members, because you have some amazing things going on, and your story should definitely be heard, 100% preventable. And it's only through our stories that we're going to be able to make change.
Thank you.
Thank you so much.
I'm Alisha Liggett. I'm a family medicine doctor. I practice in New York City, in the Bronx, actually. I have actually a personal story with preeclampsia. So besides, you know, helping women in their prenatal journey in my clinic, and also helping people prepare for pregnancy, and, you know, telling people about what preeclampsia is, you know, it's something that I actually never thought that I would experience in my own pregnancy. The preeclampsia actually developed later in my pregnancy, kind of close to delivery. I believe I was 39 weeks at the time when I went in for a visit to my OB. And usually at every visit, they take your blood pressure, and they also weigh you. They take your urine to check for any signs of preeclampsia. And I had noticed that in 1 week's time, I had gained 5 pounds. And I mentioned that to her because I had been pretty much gaining 1 pound consistently weekly, which is, you know, pretty much on par with what is expected. But I gained 5 pounds, and I just thought it was odd that I had gained so much weight in such a short period of time. And she's like, oh, you know, it's, you know, we'll just watch. Pregnancy pretty much proceeded as normal. I was also a gestational diabetic, diet control. So after I was diagnosed with gestational diabetes, which is also a risk factor for preeclampsia, as well as my age, because I was 37 at the time, I, you know, was pretty serious about making sure that I did everything I could to stay healthy. You know, I was on a very strict diet to control my sugars because I absolutely did not want to take insulin. And I was very diligent about my health, so I just assumed that everything was going to be fine. But I believe I was 40 weeks when, like 40 and a half weeks when I actually was induced, because I was, you know, going a little bit further than they wanted me to, given that I was a gestational diabetic. I went in for an induction, and you know, my blood pressure was a little high. It wasn't even super high. It was maybe 140s over 90s. So it wasn't really high enough to really raise the alarm when I had just arrived to the hospital. But when they took my blood work, they realized that, you know, things were definitely like amiss. In addition to, I had gained more weight. So, you know, by that time I had gained 10 pounds in a 2-week period, which is, you know, really not normal. And at that point, my liver enzymes were starting to go up, platelets starting to drop. and I was feeling okay at the time. I was like, oh, well, they're like, are you okay? You feeling fine? I'm like, no, I'm good. I'm feeling fine. A couple of hours later, as my labor is proceeding, my blood pressure is just really skyrocketed up to 190s over 110s, even into the 200 range. They redid some labs, and my everything was just going wrong, including my kidney function, which is another potential issue that you can have when you have the HELP syndrome, which is what I have. Excuse me. Low platelets. You have liver enzyme elevations. You can have pain in your abdomen. You can also have kidney issues, which I did. You actually start to go into acute kidney failure, which happened to me, as well as the headaches and all of that. I didn't have headaches, but I definitely started to feel, as the labor was progressing, like kind of out of it, like not disoriented per se, but just feeling like you're not quite thinking so clearly. And so I was like, okay, I'm just trying to remain calm through the whole thing, because, as a physician and as somebody who's trained in a hospital in an OB setting, I know that, there is a lot that goes on behind the scenes. So just trying to be calm, trying not to be like the overbearing doctor patient that tells everybody what to do. So plus I had a doula, which is super important. It doesn't matter who you are, what socioeconomic status you are. Even as a doctor, there was just no way that I was going into my birth experience without a doula. And because I know that doulas save lives, they improve outcomes, they advocate for you. It is important to have family members too, if you're able, but sometimes family members don't know the ins and outs of the healthcare system, the ins and outs of the birthing process, someone who feels the agency to speak up for you when you're unable to speak for yourself, so that you can really focus on laboring and not on trying to explain things or trying to advocate for what it is that you need. There's somebody there to do that for you. And there's, data to support this. So doulas are super important. I would always recommend people go into a labor with a doula. Even if you have a healthy, normal, you expect everything to go fine, just like I did, it went totally downhill as soon as I arrived there. And I was just so grateful she was there. So I was able to, because the preeclampsia started in my labor, I was able to actually deliver vaginally because, one, I had basically advocated with my doula that, we could do this in a short period of time. I feel like got things moving, which we were certainly able to. And she's like, if you want to do it, we can certainly, advocate so we can do it this way. And I said, I'm feeling okay. I'm feeling the energy. I can do this. I know things look bad. And of course, everybody on the labor floor was just like, are you sure you want to do this? Like, your labs look terrible. I'm like, I know, but I got the will. You give me a few hours, we can make this happen. And we did. And my son, was born healthy. And that was just such a blessing. But yeah, preeclampsia is really nothing to play with. It's, very serious. People die from it. And it is something that, there some things we can do to try to prevent it or mitigate our risk. But unfortunately, much of that is, all genetics. There's still a lot that is unknown about preeclampsia, why it is that Black women this disease. We know that it's a vascular disease, so any other pre-existing vascular diseases can heighten your risk and also the severity, but there's still a lot that's unknown. So even someone who's trying their best to try to prevent it, it still can happen to you, even if you do everything perfectly. So that's why it's just so important to also raise awareness around preeclampsia, so that women of color definitely have knowledge about this disease and that it can happen to them. Also for people to kind of take also a little bit of agency with your health as well. So, you can also buy a blood pressure monitor on Amazon, check your own blood pressures at home, which is what we all should be doing anyway, right? As we're getting older, making sure that your blood pressure is in the normal range, making sure that you have a healthy diet, that you're a normal weight, and also just learning a little bit about your family history. So I didn't even know that my mother had preeclampsia with me until after the delivery, and my sister was like, oh yeah, did you know that mom had preeclampsia? And I'm like, what? Nobody. I mean, I just feel like, well, particularly in my family, family history is like very secretive, like people don't really want to talk about their experience with health. I don't know if it has something to do with shame or just people being in denial about that, but it's super important to share your experience with your loved ones so that they can then, share that information with their doctors, because it could adversely affect their health as well. So it's actually a very personal experience also that I could share with patients as well, because it's very scary. It's very scary to kind of be in that situation. So I'm really happy that we have this forum today and that we can share the information.
Thank you.
Oh, Sonia, I think you're muted, my dear.
So we wanted to go around and just ask a few questions for people who have actually experienced this. We thought it would be very beneficial and a lot of knowledge to go around on some things that some of us may not know, or just to help them to raise the awareness. So we'll actually start with Ms. Tibbs. So the first question I have for you, you spoke on being a doula, and we also did research and shows that a lot of African Americans are starting to go within becoming a doula just to help because of so many of the medical problems we have come about. So what ways can a doula support a woman dealing with preeclampsia?
Yeah, so a doula can support a woman dealing with preeclampsia